Hello. So today we're here with one of my favorite neurologists and magic makers in the country. It's Dr. Fawad Mian, and he's located in Denville, New Jersey. Traditionally has been a neurologist for many years. I won't say how many years, okay? And then transitioned also into opening a medical spa inside his medical practice, inside his neurology practice. So I'd like to cover that a little bit. You're definitely an innovator, Dr. Mian, and I'd like you to speak to, what motivated you to start ProloHealing Medspa inside of your NeuroWellnessMD medical practice, neurology practice. Please, let everyone know.
Yeah, well, thanks for asking me that question. For years, I've been a traditional neurologist, and I've always had patients come to me with various different complaints, and I would do the best I can to try to help them out. But over time, people, for instance, from the cosmetic realm and even in the pain realm, people would start asking me, well, I'm having some hair loss. I went to the dermatologist and told me there's not much I can really do. What can I do for this? A lot of times they would tell me about the scars on their face or their complexion. And this is me just being a neurologist, seeing them for something else like headaches or migraines or neck pain, back pain, things like that. And they're asking me about this. And at first, initially, for a couple of years, I kind of just skirt along and kind of almost dismiss it to a certain extent. But people kept asking me about different things, I guess, that weren't being answered by their other docs. And so for me, it was just a matter of saying, hey, what solutions can we have to really help these folks out? So initially, I started more in the pain realm when people are having chronic aches and pains in their joints and tears, like within the ligaments. And I started getting into ProloTherapy, platelet-rich plasma, and stem cell therapy over time. And I found that to be very successful for a lot of folks, including myself, who had gone through the same kind of thing. But as time went along, people started asking more about their hair, their face, their skin, and even their weight. No matter how many times I've told people to work on their diet, their exercise, or whatnot, it's not always that easy. And sometimes you need that kind of motivation too as well. And sometimes you just need those extra tools as well to try to help get people in the right kind of place, because it really involves a multifaceted approach in terms of getting people better. So we added in the emerald laser, which is actually there for fat loss, and that can be combined with other supplementation to try to help appetite suppression to a certain extent so people can lose fat and weight at the same time.
Yeah, that's really interesting. I love hearing it from more the medical perspective too, because, health insurance is fantastic, right? It covers a lot. It's nice. But I noticed that lots of times you're having to veer off into more of that cash pay, that area where people have to cover it themselves. But it works, so it's worth it. And I know it's not easy to juggle both sides. So I have a lot of respect for you for delving into that world of cash pay. Plus you've got the insurance portion of the business. It's not easy. So let's talk about pain, because that is a huge issue. And you mentioned migraine headaches and joint pain. And I know that you've worked miracles with people with back pain, and most everything, it's all natural remedies with PRP, right? So you're working magic with pain for anyone in Denville, the Denville, New Jersey area. That's your man right there. If you think there's nothing that can help you, go over and see Dr. Fawad Mian, because he can help you. Tell me a little bit about PRP and what you're doing with PRP. And it's all natural, right?
Yeah, I mean, PRP is essentially what you get from your own body. So there's nothing, aside from me, anesthetizing things and a little bit of saline, you're pretty much using your own stuff. And so platelet plasma can be pretty robust. And originally it was used in the dental world and for wound healing back in the 90s. And then over time, we found it to be more successful for more musculoskeletal issues. For instance, the first iteration of where I used it actually was at least probably 10, 12 years ago. And, I had an individual with some tricep pain, and, the patient had gone to orthopedic doctor and then the pain doctors, nothing was getting better. She had a little bit of tear in her triceps tendon. So I actually treated that with PRP at the time. And even though it took, a few rounds to get it better, she was way better than where she was. She wasn't suffering, just trying to do things, because she was more of like a manual labor person. So she was just trying to use her arms all the time, and that was her livelihood. Is certainly working. And so if I had dumped steroids into that tendon, that would have been irresponsible, because if you dump steroids into a tendon, you're just breaking it down even faster, which leads to more of a surgery that would have been completely unnecessary. I've had lots of PRP and prolotherapy and all that over the years, and that's something for me where I was able to overcome plantar fasciitis, which is issues with your foot, as well as an Achilles that was kind of beat up too as well. And that prevented me from having surgery. And, at one point the surgeon was like, well, I think we just need to shave the bone down because you're not responding to anything. I've had all sorts of surgeries and I've had steroids. I've had a lot of stuff patients always ask about. So I've kind of gone through a lot of what they've gone through. And having gone through all of that, having said that, I wouldn't even hesitate now to err more on the side of doing platelet-rich plasma or even stem cell therapy or prolotherapy, just because I think at the end of the day, it's going to preserve things much longer for you. And sometimes when you do surgery, you can't really go back because then the anatomy has been altered, and then sometimes that can lead to its own series of problems. And in which case for me, I had a knee problem where I tore my ACL and the graft didn't take essentially. And so I had to go in there with PRP and put PRP in those areas to help alleviate that. That really helped me. And I've had plenty of patients where we had to do that too as well. Just because you have surgery doesn't mean everything is going to be great. It doesn't mean that you won't have issues or whatnot. And you definitely want to carefully consider whether or not you need to have surgery. In some cases, you very well may need to have it for very clear-cut cases, but that's not always going to be the only solution each and every time. And even just taking pain relievers, over the counter or whatnot, they don't necessarily help heal things rather than just simply giving you a temporary pain relief. For me, I definitely give people their options with things and try to get to the root cause as much as possible and try to get people on their way where they feel like they can function and do stuff with their families and play with their kids or do the activities that they love to do.
That's great. It's invaluable. It's so funny. This just reminds me of years ago. I ran a medical equipment supplies company and we were big in infrared therapy. We ran into a good deal of the workers' compensation or self-insured corporations who are concerned with steroid treatments and the damage it was doing. So I noticed you mentioned steroids, that you're not a fan. And I agree with that 100%, that it breaks things down. And also the use of muscle relaxers and, pain medications that people are getting addicted to. That's huge. So this sounds like a good route for people to take too, if they want to avoid addiction or start weaning away. It's mainly muscle relaxers and pain meds, right, that are the big problems behind the scenes.
Even narcotics, that's been obviously in the news, over the last few years. And sometimes I think it's just honestly excessive the amounts people are taking. And I will give a small dose of Percocet for a day or two after a procedure just for temporary pain relief, but that's how it's supposed to be used. While they do help temporarily, they also don't fix the underlying issue. It's just more of that Band-Aid effect that you're getting with that.
Okay, that's great. So PRP, there's a magical element to our blood that you're using that helps speed the healing process, your body's natural healing process.
Within the PRP, there are platelets and they have certain substances that actually kind of get released in the areas of damage and they help recruit other cells and other growth factors to help heal the area. Not a whole lot of downtime with it, but I think it's a great treatment.
So on the pain front too, I know that you're magical with Botox and what you're doing for the aging face with Botox. And, God bless you. I've heard very, very good things about your work. You're also using Botox for pain, aren't you, for headaches?
Usually for headaches, I have a very multifaceted approach, so one size doesn't fit all. But, Botox, I've been injecting that for a long period of time. For migraines, I started doing it when it was FDA approved back in 2009, 2010. I can't even remember the year anymore. And it works pretty well for the most part. Generally, we kind of have to add in other things in addition to Botox to have that relief. Some people like the fact that, hey, it can actually, even though I'm not technically doing it cosmetically, it can help the wrinkles and people are kind of happy about that. But at the end of the day, they still need other things that they need for that. And sometimes it may be supplements. Sometimes it may be something as simple as magnesium. Sometimes it might be other medications if need be. If there are people who have chronic neck issues, I've seen a lot of people with chronic headaches because of the neck issues. And, I've even tested out even years ago, just doing nerve blocks and alleviating the person's symptoms completely for like days on end until that kind of wears off. And so I've been able to actually do PRP within the cervical spine to try to help stimulate healing of some of the ligaments, tendons, and joints so there's a little bit more stability. And that's, proved to be very successful as another alternative treatment for headaches and migraines. In the cosmetic realm, obviously been doing it for a very long period of time. So there are all sorts of nuances that can be used in addition to migraines, obviously for smoothing out the wrinkles on the forehead, the 11 lines, the crow's feet, very common things. I've used it for like jaw dystonia, and also it sometimes just helps with facial slimming. So for people who are clenching their jaw a lot, for instance, and a lot of those people who are just chronic with stress, just putting Botox in over here kind of has a slimming effect on the face. So it
Hmm.
tends to be less of that broadened box-like face that sometimes people have when they're just clenching so much.
I was going to ask you about TMJ. So that's related, the clenching and TMJ. And I know a lot of injectors, a lot of nurse injectors are afraid of going anywhere near this area. They don't totally feel comfortable because they know there's a lot of nerves and things you can ruin there, right? But you're not
Yeah.
afraid.
Yeah, no, you gotta obviously know what you're looking for and what you're doing with that. Typically people have these kinds of issues. They're fairly easy to identify with a little bit of time. And I've injected a lot of TMJ joints over the years too as well, and it's proved to be pretty successful in terms of minimizing those sorts of headaches.
So you're located in Denville, New Jersey, and you're serving this area, but what's the closest airport to where you are, just in case someone is interested?
Newark is probably the airport, probably only maybe 30 some odd minutes from where we are.
All right, great. Good to know. So in treating pain, I've noticed too that you bring up this topic of weight loss, that this comes up very often, especially as a neurologist. People come in with the weirdest things, and you tend to go to diet, exercise, weight loss. Can you tell us a little bit about the magical things that you're doing to help? At least I love your mentality about this, because you don't necessarily believe that the patient's going to come in and be willing to make these huge radical changes in their diet, exercising. It's good to say that, but are they really going to do it? So what are the things? I had the emeralds come up and just other things, maybe injections, whatever it might be. What are you doing to at least spark this initial weight loss, or the inspiration of getting someone on a better path physically that way?
Honestly, it kind of goes back to the end result. What does the individual really want? Kind of look at it where, hey, look, I'm having, a lot of chronic aches and pains. My knees really hurt, and that's the reason why they're coming in. But the question is, how do you get there where your knees stop hurting so much? And so that's kind of where it comes into like the diet, the weight loss, and those kinds of things. I always try to just start out with some more basic changes. So sometimes it's a matter of just cutting out some simple things. It doesn't have to be every single little thing that they're cutting out. But if they cut out, so for instance, like gluten, or cut out dairy, or probably the most easiest thing to cut out is sugar. It's just anything that's sugar laden. Just cutting out that and starting off with something like that can make like a huge difference. We try to tell people to do, stop everything and just eat like grass and like sticks and rocks. Nobody's going to do that, because sometimes that's how strong that can be. But it's something is also telling people, hey, look, maybe you want to increase your protein intake. If you eat some more protein, that help with the muscle mass, number one, which will inevitably, if you start exercising, will help with stability of those joints. But at the same time, that'll help curb your appetite too as well. There's certain supplements also that can help with just appetite suppressants. So sometimes just changing a little bit with supplements and a little bit on the diet to a certain extent. And then we get into like the emerald laser. The emerald laser in of itself does more fat loss than weight loss. Certainly if you lose fat, you lose some weight. Obviously it can also be used for the arms and thighs and the legs. But one of the reasons why I also like it too as well is that you're getting rid of some of that excess fat. Some of that can also be inflammatory. So you're just getting rid of some of the inflammation. You're starting to look and feel better at the same time. So at the end of the day, people then become more motivated to make more changes. It's kind of more like a springboard for everybody.
That's great. I happen to love this topic of targeted fat loss, especially because, I guess more females than males, but we don't look in the mirror and say, oh my God, you're beautiful today. We'll always look at that one spot that bothers us, or that one thing that bothers us. And I love that you're able to do that, but it's also nice that I want to go into, you did a tremendous amount of research, and I know that you're not a fan of cool sculpting and that technology for obvious reasons, that causes some major issues and there's side effects and things that can go wrong. But I'm really curious about the technology behind the emerald laser and what made you go in that direction, and is there downtime? Is it how long does it take? And, those kinds of things.
One of the reasons why I chose the emerald laser over things like cool sculpting or end sculpting, those kinds of things. Number one, in comparison to cool sculpting, for instance, there's no pain with this. In cool sculpting, people have pain, numbness, tingling, burning sensation. Sometimes people get the hyperplasia or the stick of butter, and It's been in the news recently with some, with a model had like an issue with that, and it becomes just problematic. It causes less fat loss reduction than the emerald laser. It's pretty simple. So it's a laser that doesn't burn or anything like that, and it's non-painful. There's no pain associated with this whatsoever. But essentially, what it does, it just pokes holes in the fat cells, and so it helps the fat cells leak out some of the fat, and then through your lymphatic system, kind of helps get drained away. So things that help with that obviously are exercising and sweating it out. And also drinking lots of water to help flush out all of that. The better results are typically going to be people who have more 8 to 12 sessions, essentially, and they're diligent about having their sessions done. People can do pretty well with that. And again, it only takes like half an hour to like do this. So, you can do it like in the middle of your lunch break, quite honestly. Go back to work. You don't have to worry about, hey, I'm going to be in pain or I'm going to be uncomfortable and then I got to work. So it's a pretty safe treatment. Haven't seen any issues with it medically whatsoever with it.
Have you noticed that when people, finish this treatment, and you're saying it's like 20, 30 minutes, they're going to see results every single treatment. And lots of times they'll get it on one part of the body and then come back and get it on another part of the body. So I love hearing that they're seeing results, and you're seeing that it's sparking them into, just being more motivated to eat healthier and not ruin the fine work that the Emerald just did.
Yeah, I think to me, that's probably one of the biggest things. But at the end of the day, it's, you can maintain your results so long as you take care of yourself, just like you do with your hair, your skin, your teeth and all of that. That's what I like about it. There are medications out there for weight loss, like the Ozempics, the Wegovys and all that. And those are all well and good. And I think they're well-intentioned medications, can really help with the diabetic. There was a rep that came out probably 10, maybe 11 years ago, told me about it. But they were kind of saying, hey, we're going to try to use it for weight loss. And then it kind of, over the last few years, it's kind of taken off on its own. But I think sometimes the problem with that is that people are not really making any changes in the background in terms of what they're doing. So they're still getting poor sleep, not really exercising, not taking care of themselves, still eating very poorly. So while it does help suppress appetite to a certain extent, it's not really going to help you so much in the long run, so long when you eventually get off of it, because you're just going to get all the weight back. Kind of really important to really understand and realize that. And just with any treatment I do, I always try to use it as a springboard just for better health in general. And so those people who are doing that always inevitably have the best results.
That's great. So this leads to sexual health. So, lots of times too, it's like, are you a lights on person, a lights off person? Lots of times also your sexual appetite can be tied to what you're eating and how you're taking care of yourself during the day. But I'd be really interested to know, I know that you are very, very talented when it comes to this topic of male sexual health. I really would love to get your medical opinion of that and what you're doing to help men and their sexual health.
Everybody's got some testosterone, estrogen, but when you have excess amounts of that, then it kind of affects everything else. So you don't want to have too much of that in your system, essentially. When it comes to, just people with ED, which is part of this space too as well. For some time now, there's been treatment with platelet plasma, PRP, which can help with the vasculature within the penis to help with that so that people can have better erections. That's typically combined with the shockwave treatment, which also stimulates healing too as well and same flow to the area. So when you combine that along with just looking at some of the more underlying issues, people will have better results overall versus just taking a hormone replacement therapy and not doing anything else. So again, it's kind of taking more of that deeper dive and trying to get people better. When you put all that together, people just really tend to do much better in the long run. So that's kind of more of what we tend to do.
I know shockwave has been, it's a scary sounding therapy, but it's been around a long, long time. And I've heard very good things about that. So you're a fan of shockwave therapy?
Yeah. So we use it for pain and they use it for sexual health too as well. So it's something that doesn't really cause any significant pain whatsoever. The name doesn't sound the best in the world, but it doesn't cause any significant pain. And actually, when you utilize it too as well, even if on a painful area, within like a minute or two, you start noticing that stops hurting. So it feels better. So it's already stimulating some healing, even though it does take time. So shockwave for pain does take time, just like any regenerative treatment. But even with flow to the penis too as well, it does take time. And most people tolerate it really well. So it's not like it's something that folks have to be really scared about or whatnot. So a lot of times they'll even just, put the machine on somebody's arm to let them know how does it feel. And they're like, oh, okay, it's not so bad. It's really, really not that painful. Quite honestly, it's not painful at all. I've had it like, a bunch of times too as well, even on like, tender points and things like that. So it's not significantly painful. So it's definitely something that's been used more in the regenerative realm too as well over the last few years. And there's been more of a push to utilize it.
It just amazes me that someone, if you've got a neurological issue, go see Dr. Fawad Mian at NeuroWellnessMD in Denville, New Jersey. There's the combo of when you veer off into a therapy for pain relief or some regenerative need, maybe you're just aging or have pain, whatever it is. It's so nice. I know I appreciate this, that when I'm seeing a specialist, that they're not just going down the insurance route, but they're actually looking at a care plan. That's the best for me as a human. I really appreciate this so much. Thank you, Dr. Mian. How would people get in touch with you?
A couple of different ways, one of which is obviously you can directly give us a call at 973-928-3288, or, they can contact us on our website at www.ProloHealing.com. So people can just, get on there and, look at the information that's there, and then they can reach out to us.
So if you want to subscribe to Dr. Mian's YouTube channel, go do that at ProloHealing. Thanks again, and I'll look forward to talking to you again soon, Dr. Mian, okay?
All right,
Thank
thanks
you.
so much. Thank
My
you.
pleasure.